7.
And David Clark, the Health Minister, was listening to that and joins us now. Good morning, Minister.
Morning, Guyan.
Chuah, did he resign or was he pushed?
Oh, look, it was absolutely the Director-General's decision to end his term early, and I respect that.
Do you welcome it?
He felt it was time for fresh ideas and leadership, and I agree with him.
Did you think he did a good job?
Look, I think he has made the right call in the circumstances. He has made way to allow for that building of unity in the sector that is so desperately needed. As opposition health spokesperson, I spoke to a lot of people across the sector and heard a lot of concern about the relationship with the ministry. And in government, as I've made my way around the DHBs, I've heard similar concerns. This presents a real opportunity for new leadership, for a building of trust that is desperately needed. Everybody in the health sector fundamentally wants the best for the public patient, and I'm expecting that the new person that comes into this role will lead on that.
Okay, and we'll talk about what effect any of this will have on the quality and performance of the health sector in a second, but I want to talk about political neutrality, because we tell ourselves that we have a politically neutral public service. And yet you were wrapped over the knuckles, or at least your party was, by the State's Services Commission in June when he wrote to the leader, Andrew Little, basically saying, look, lay off this guy. He's not a political combatant, if you like, and this behaviour was inappropriate, and now he resigns.
Yeah, look, Guy, I think if you go back and look at the statements I made, I've always been very careful. I was very critical of the previous minister, absolutely no bones about that. I thought he was failing in his duty to improve relationships and to lead in the health sector. And I, at times, with the budget blunder that put financial planning back in the DHBs, said that the ministry's performance was less than adequate, and that if the minister wasn't satisfied with it, that reflected poorly on him.
But
that's as far as I've ever gone.
Yeah, but if I could quote from Peter Hughes's letter to the leader of the Labour Party at the time, quote, I am concerned about the personal criticism currently being levelled at a named individual public servant. My strong view is that is inappropriate and unfair to debate the performance of a named public servant in the manner currently taking place. And then we had you, when you first took over as Minister of Health, saying that you might request the resignation letters of the chairs of DHBs.
Yeah, I'm after governance, strong governance in the sector, Guy, and I make no apologies for that. And I also want in the chairs of the DHBs people who will implement the priorities of the current government, which include making sure that we have more equitable outcomes. The word inequalities doesn't feature once in the New Zealand health strategy. I want to make sure that we have strong mental health services and that we have a greater emphasis on primary care. Now, I haven't requested the resignation of any of the chairs, Guyan, because they have all assured me that they are on board with that direction and they're looking forward to delivering for New Zealanders.
So you didn't go ahead with that because you were speculating about that, weren't you?
I was asked the question by Karen Brown, actually, as to whether I would ask for the resignations, and I said, look, I'll take advice on that, but what I really wanted to know and have affirmed for me was that those people in those key roles would be on board with the program and help us to implement it so that we can make sure that New Zealanders have affordable access to quality care.
You got confidence in the remaining ones. Of course, Bob Simcock's gone. He was the former National MP. He's resigned. But the others you have confidence in.
Look, I have no reason at this stage to question any of their actions. I want to see those health services delivered, and I think New Zealanders do, because we all care about the public patient.
Indeed. So, this new advisory group, Karen Brown touched on it before. This sounds like a pretty big move. It sounds like you think that there's pretty much a crisis in the health system.
Well, I do think there has been a lack of leadership at a strategic level, and there is a lack of trust with the DHBs. I think I heard Karen's report, and I think she described those things quite accurately. Senior leadership across the health sector has had a concern for some time, and this is a way of making sure that we put ourselves back on the path to doing what we need to deliver to deliver for New Zealanders.
So do you have confidence in the public health system at the moment?
I think the public health system continues to deliver well because of the hard work of the public servants, the surgeons, the allied health workforce, everybody within it. But it's been an incredibly strained 9 years with tight funding around the health sector and a national government that frankly did neglect the health system. It wasn't a priority for them. People in the system have worked hard, but they're under stress and strain, and those relationships were stretched and they need to be put right.
Okay, well, you've got your $8 million in new funding. Why do you need this new ministerial advisory group? What is it actually going to do?
The advisory group will advise me at obviously at a governance level. There's strong governance skills in that group. They have relationships across the sector that are warm and existing. Many of them have worked in different parts of the sector, so I'll be looking to use those skills and the intelligence that brings along on the journey to ensure that we
what does any of that mean?
Trust and confidence.
They're just words that are strung together. What does it actually mean? What are they going to do?
All sentences, Guy, are words strung together.
I know, but what does it actually mean? I've got no idea what this group's going to do.
This group is going to advise me on how to better make sure that we get value out of the sector that New Zealanders would expect. We know that the structure, for example, that's been in place has been in place for a long time. There's a lot of people across the sector I've spoken to have said it's time for some change. You know, lots of people are debating.
Well, let's have a look at that then. The people you've put in there, it seems to me, are the very people who are responsible for building up this health sector as we've got it over many years. Dr. Lester Levy, correct me if I'm wrong, he chairs, I think, 3 Auckland District Health Boards. Karen Batasi is a former Director General of Health. You've got Sir Brian Roach, who I think was brought in as one of the commissioners when David Cunliffe sacked the board in the Hawke's Bay in, I think, 2008. I mean, these are the very people who've got us to where we are now, aren't they?
Well, these are people who have deep experience, and I think most leaders in the sector acknowledge that there is room for change to improve things, that the system currently is not delivering as well as it could. That the reason it does deliver well is because of the people in it who are willing and able to help people in a practical level, but that we lack a long-term vision for how we will improve the health sector. The New Zealand Health Strategy, I'll go back to the point, has only mentions inequalities once. Not at all. Not one time does it mention inequalities in the sector. And for me, as part of my priority, I want to address the inequities we see. I want to make sure we do deliver through primary care, and mental health services have been neglected and are not performing as well as New Zealanders would expect. All of those things will require some significant change, and I want confidence from people who are deep in the sector that when I make decisions, they're sound, and that I've got a good sounding board and people who will advise me to make those decisions well. I think that's what New Zealanders would expect.
So how is any of this going to make life better for the people who use the public health system, for the patients?
Well, Guy, if we are delivering services sooner because people are going to their local GP, they're not getting as sick, that also cuts cost out of the system. I think the overarching thing I should also point out, Guy, is this is costing no extra. All of the funding for these senior people to advise me comes from within the ministry's existing budget. So this
hang on, you're taking money out of the existing budget to get these people to advise you about what to do.
Yeah, I'm appointing some senior people in the sector who will build confidence and trust, and I think if you speak to people across the sector, they'll say that's needed.
How much is this going to cost?
The people on the board will be paid, and I think fees structure number 4, and it's $818 a day for the chair and $518 for the other members.
Over 2 years.
Yeah, as and when needed, Guy.
Yeah, and that money comes from existing budgets.
That's right.
Yeah. Thanks very much for joining us this morning. I do appreciate your time. That's David Clark,
Guy,
who is the Minister of Health, and it's 27 minutes to 8.
Looking at some traffic news in Wellington, there's been a breakdown.